Puberty and its Pathophysiology. Pediatrics Course 4th Year. Puberty is a complex developmental process culminating in sexual maturity. This transitional period begins in late childhood and is characterized by maturation of the hypothalamic pituitary gonadal axis, the appearance of secondary sexual characteristics, acceleration of growth, and, ultimately, the capacity for fertility. Puberty. Definition. Puberty, characteristic and environmental factors. Centrally driven. HPG axis. GH and gonadotropin secretion. General health, nutrition, exercise. Genetic influences, race. Socioeconomic conditions. Programmed from intrauterine environment. Puberty, characteristic and environmental factors. Hypothalamic pituitary gonadal axis, fetal. Hypothalamic pituitary gonadal axis, early infancy. Hypothalamic pituitary gonadal axis, childhood. Hypothalamic pituitary gonadal axis, late prepuberty. Hypothalamic pituitary gonadal axis, puberty. Puberty. Contemporary issues in pathophysiology. Onset of puberty. Sequence of normal puberty. Pubertal development is precocious when it occurs before the ages of 8 years in girls and 9 years 6 months in boys. In at least 50% of cases of precocious pubertal development, pubertal manifestations will regress or stop progressing, and no treatment is necessary. Gonadotrophin-dependent, true, central. Gonadotrophin-independent. Precocious puberty. Delayed onset of puberty is defined as occurring older than 2 after the average age. Girls greater than 13.4 years old. Boys greater than 14 years old. Constitutional delay. Commonest condition seen by pediatric endocrinologists. Positive family history. Height prognosis appropriate for parental centiles, although in severe cases upper body may remain short. Bone age is delayed and consistent with degree of pubertal maturation, usually delayed by 2 years or more. Often associated with constitutional short stature. Progressive height gain, but along lower limits of normal, contrast to isolated gonadotropin deficiency which is normal growth, but no pubertal growth spurt. Treatment for psychological reasons, with low-dose ethinylestradiol. Onset of breast development with a growth spurt and problem usually resolves. Delayed puberty. Delayed onset of puberty is defined as occurring older than 2 after the average age. Girls greater than 13.4 years old. Boys greater than 14 years old. 1. General. Constitutional delay of growth and puberty. Malabsorption. Underweight. Chronic illness. 2. Gonadal failure, hypergonadotrophic hypogonadism. Turner's syndrome. Post-malignancy chemo, radiotherapy, surgery. Polyglandular autoimmune syndromes. 3. Gonadal deficiency. Congenital hypogonadotrophic hypogonadism. Hypothalamic/pituitary lesions. Rare gene mutations inactivating FSH/LH or their receptors. Delayed puberty. Assessment of puberty history. Review of systems. Examination of growth. Pubertal assessment, Danner staging. Neurological assessment. Assessment of puberty,